Vanakkam. As doctors and surgeons in the service of treating patients, we are successful sometimes. Patient is happy, we are satisfied. But there will be situations where we encounter failure. We might have sat for 8 hours doing a surgical procedure, putting our heart and soul into it, but it can fail. How should we take it? Won't we feel dejected? What should we do next? Would we have the morale and courage to do the next case? So we need guidance in this aspect. Who else to look for guidance but the Tamil saint poet Thiruvalluvar, and we shall interpret what he has said about failure, success and learning from failure. When a doctor sets out to treat a patient or do a surgical procedure for a patient, he or she means well, but the results may not always turn out as expected, since there are so many factors that can influence the outcome. So failure can and will occur in some situations. Even though failure of treatment affects a patient primarily, it also affects the treating doctor or surgeon. How should the doctor or surgeon handle these situations of success or failure? A wise saying goes like this: do not let success go to your head, do not let failure go to your heart. But what does the Thirukkural say about this?
கேடும் பெருக்கமும் இல்லல்ல நெஞ்சத்து கோடாமை சான்றோர்க்கு அணி கோடாமை சான்றோர்க்கு அணி.
It reads like this: கேடும் பெருக்கமும் இல்லல்ல நெஞ்சத்து கோடாமை சான்றோர்க்கு அணி. The word kedum refers to loss or failure. Perukkamum refers to success or gains. Illalla, it means ill alla, have not come to stay. That is, failure and success are not here to stay. They are not permanent. Nenjattu, the heart or the mind. Kodamai refers to impartiality or treating with the same outlook. Sandror refers to educated people, learned people or mature people. Sandrorku refers to for the mature people. Ani means a virtue, a decoration. What it means is that failures and success are not permanent. And when they do occur, the mature person or learned person will remain calm, tranquil and unshaken. All he has to do when he begets success is to thank his team, thank God, thank his teachers and move on. But when there is a failure in spite of his best efforts, he has to think with a clear mind. I shall describe what a surgeon needs to do when there has been a failure. The first thing to do is handling the patient. The patient must be informed that the surgery has not worked out as had been planned. This news will usually go down well with the patient if all this had been warned before the surgery and patient had been counselled well. If the patient had accepted the possibility of these complications, he would understand pretty well the problem that has occurred now. A calm and empathetic approach on the part of the doctor or surgeon will help to a great extent. Simultaneously, we have to handle the attenders or caregivers of the patient. Even though the slim chance of failure and the need for revision procedures should have been explained to the patient before the primary surgery, it is important to go to the attenders and caregivers again to discuss the further course of action. This will include 3 points: the need for a longer stay, the need for additional expense and the need for another corrective surgery. We should then go ahead with handling the original problem for which the surgery had been done. For example, if there had been a wound and the skin cover that is, plan A had failed, what should be done to cover the wound? All he needs to do is carry out plan B. Your team is an important part of you. Handling your team members is also very important because they have a role in the entire procedure. They are also interested in the well-being of the patient and the success of the surgery. The morale of the team must be maintained and must not be allowed to sag. Discussing the causes of failure with the team will help boost morale. And finally, handling yourself. First is handling the stress of the resurgery. You need to concentrate on the next thing to be done and go ahead with the alternate procedure after discussing with the patient and attenders of the patient. If necessary, you can seek help from your colleagues to perform the next surgery. Second is handling the stress of convincing the patient and the attenders. Never avoid meeting the patient or the attenders. In fact, it would instill confidence in them if you take extra genuine care in the well-being of the patient. Then comes the next problem. Where was the fault? Is it not easier to blame the patient for what he has done or for what he has not done? A good leader like a surgeon must work differently. In fact, there is a couplet in the Thirukkural which says,
தன் குற்றம் நீக்கி பிறர் குற்றம் காண்கின் பின் என் குற்றமாகும் இறைக்கு என் குற்றமாகும் இறைக்கு.
It reads like this: தன் குற்றம் நீக்கி பிறர் குற்றம் காண்கிற்பின் என் குற்றமாகும் இறைக்கு. Tan kutram refers to your own fault or his own fault. Niki, analyze and remove. Pirar kutram, the faults of others. Kaangirpin, later see. En kutram ahum, how can you fault? Iraike, the king or even God. It means that you cannot find fault with a king who first finds fault with himself before finding faults with the others. The sensible and mature surgeon will sit down and analyze what went wrong and whether he could have done it better. This will teach a good lesson which can be used when he is treating the next patient. This is what is known as progress. A failure is not a failure when it has taught you a lesson. So, when you have a failure, be open, accept the failure and the responsibility for the failure. Do what is required to correct the problem and then introspect, either by yourself or with your team, and discuss frankly what went wrong or how it could have been done better. Thus, a failure becomes a step to take the surgeon and his team a little higher. Provided, of course, that a lesson has been learned. கேடும் பெருக்கமும் இல்லல்ல நெஞ்சத்து கோடாமை சான்றோர்க்கு அணி. Handle both success and failure impartially. Do not let success make you arrogant and do not let failure make you dejected. தன் குற்றம் நீக்கி பிறர் குற்றம் காண்கிற்பின் என் குற்றமாகும் இறைக்கு. In case of failure, introspect, analyze and find the cause, how you could have done better. This is the characteristic of kings and leaders which you are. Having learnt your lesson in the so-called failure, take your next step towards success. I hope you liked the video. I enjoyed making it. Please click on the shown links to see more about what the Thirukkural has to offer and how we as doctors can interpret it. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics. Vanakkam.